So this is Dr. Scott Geller, a floater expert, laser expert, 20,000 sessions, I believe, or more, over the years. And we are at the end of March 2021, hopefully at the end of this COVID stuff. I have a great patient here from Colorado, spending the winters in Florida. What were your symptoms and how many years did you have this floater business?
I would say I had this floater business for a little over 2 years after I had a vitreous hemorrhage.
Vitreous hemorrhage, correct. And what other you have? I forgot. Have you had any other eye surgeries?
Yes, I've had cataract surgery and I've also had LASIK surgery.
Okay, correct.
But after the vitreous hemorrhage is when I really had a lot of debris, a lot of floaters in my eye.
And of course, your doctors told you nothing could be done, or vitrectomy.
Vitrectomy was my only option at that point.
Right, and that was how many years ago?
That was about a year ago.
A year ago.
Yes.
So somehow you found me, or?
Yes, I was interested in getting a second opinion and a different option other than the vitrectomy, which to me sounded like a pretty serious eye surgery that I was a little nervous about having, and I found you online.
Yes, and indeed, a vitreous hemorrhage can be very disabling. But I've also seen a lot of patients after cataract surgery, they develop what we call a vitreous detachment, and they get a big opacity, sometimes behind the implant, that makes their vision almost worse than it was before, I would say, early cataract surgery. So we did 3 sessions.
Yes.
And did the floaters obscure the object you're looking at, or just blurred a lot of stuff?
It blurred it into, I'm a retired CPA, and I was unable to differentiate between certain numbers like 8s and 6s and 5s and 3s. So it was really a pretty debilitating floater that was causing me these issues.
Yeah, and you said after the first session?
After the first session, I could tell the difference between my numbers. It was a really remarkable improvement.
Right, and laser is very easy. That's not to say anything against vitrectomy, except if you're over 40, you're guaranteed almost 100% developing a cataract, which requires another operation, and not every operation turns out perfectly.
Exactly.
And with vitrectomy, there's a certain percentage of patients, no matter how expert the ophthalmologist is who's doing it, that will develop a retinal detachment or a vitreous hemorrhage. In any case, we had 3 laser sessions.
Yes.
You're happy with the result?
I'm very happy with the results.
And it's
yes.
a significant improvement, and that's all that counts.
That's right.
And yeah, I hope you take this back to your doctors in Denver. You had some of them?
Yes.
And tell them about that.
I will definitely do so.
Thank you. Have a great trip.